Hi everybody, this is a video about my dog Tilly, who's being diagnosed with diabetes. She's a Patterdale Terrier, crosswear, Yorkshire Terrier. Bit of background on a story about her diabetes. She's 13, so she's knocking on a bit now. She's been noticeably losing weight over the course of a couple of months, but still eating like a greedy mare, like most dogs do. Then we started getting the odd accident on a night, which then developed to the odd accident through the daytime, which was very unusual as well. Then there was a noticeable increase in her drinking, which was a major concern. We thought, oh, kidneys, something's going wrong here. She had the odd bit of sickness, but the drinking was the main one to watch out for. She was drinking upwards of 3 bowls of water a day. I mean, it was hard to try and stop her because we've got another dog who also drinks, but you know, you can't restrict the drinking to dogs, especially when they're poorly, and she couldn't tell us that she was poorly. She lost a spark, she lost all enthusiasm to do out, to greet us. She was ligged about all day. Things weren't looking very good, so basically it was time to take her to the vets and see what the major problem was, and she got diagnosed with diabetes a couple of months back. Initially I think we'd let the dehydration go on a bit too long. It was a bit hard to monitor her fluid intakes when we've got another dog that was also drinking every day. When we took her to the vets on the weekend, things were pretty serious with her ketos. They were well high, as well as the glucose, and the vet wanted to hospitalise her in the vet dog hospital thing, and they were talking like upwards of £2,000 to do this for a couple of days to stabilise her. And we didn't have her insured, obviously because she's old as well, and we don't have £2,000 floating about, so it was a case of like, we're not having her put down, that's for certain. So we took it upon ourselves to take her home. We took her back on the Monday, and ketones had actually dropped. Her glucose was still fairly high, but things had actually improved, and she was over the worst of it. She'd come out of a slumber. She had actually a spark in her again, just from a weekend. She'd changed. It was unbelievable. And well, I'll show you the rest of the treatment as we carry on. Well, the rest of the story. We still haven't got it under control yet. They start you off on a low dosage, like it was something like 2.5 mils to start with, and then you build her up. She's gone to 3 mil, and now the recent visit the other week, she's actually up to 4 mil. It's still not right because she's still obviously weeing on a night, and it does take a couple of weeks to sort out. They've done blood tests and they've done like a baseline to work from. She has lost a bit more weight. We're having to put puppy pads out on a night, but it's not as bad as it was. She doesn't lose the control of her bladder during the day anymore so much, especially when we're out. I know it's hard for dogs to hold it in, but when they're poorly, it's a different story. We inject her twice a day. It's a regimental thing that you've got to do every 12 hours. You've got to feed her a set amount and then inject her at the same time, twice a day, first thing in the morning and later on at night. And the same with the other dog, he gets fed at the same time as well. Obviously you don't get an injection like, but I'll show you how we deal with the injection. We haven't gone for the fancy blinking insulin pen, which costs a couple of £100. We're just basically a vial of insulin and some syringes, which probably set us back about, well, £50 a month so far, but obviously vet fees on top of that, and blood tests as well. The bills are a lot more than that to start with. Hopefully things will calm down as we balance her insulin and her diet and we get it under control. So it is possible even with an old dog, so just stick with it and I'll show you how to do the insulin. Right. Right, something else I need to mention is these keto diastics. These are what the vets give you to test the dog's urine. We test it once a day for glucose and ketones. Now, initially when we first got her diagnosed, her ketones were dangerously high, and that probably could have killed her. But we've managed to bring that down now, and that's under control. It's the glucose that we're trying to sort out at the moment. Obviously, the more insulin she gets, the more the glucose is going to bring down in her blood. Little strip, tester strip that you dip in, 15 seconds, you check the little pink square. After 30 seconds, you check the other little green square. They obviously change colour depending on what the circumstances of your dog are. Your insulin levels as well will change depending on the size of your dog and the severity of the case. So just because I've got my dog on 4ml, it doesn't mean to say your dog's going to be on 4ml or whatever. Normally the bigger dogs are, the bigger the insulin dose that they need. So, but don't take my word for it, I'm not a vet, but we're still trying to find out what her initial insulin dose should be at, so we'll see how we go on. Right everybody, insulin time. Little bottle of insulin, obviously different brands from different vets, manufacturers, different sizes. When you get your bottle out of the fridge, always keep it in the fridge the same. Give it a little rolling. Don't go mad shaking it, right? Before you insert your needle via syringe, just check there's no air bubbles. I mean, you won't be able, I don't think you'll be able to see, but there is some odd air bubbles in there. Take your cap off the plunger bit, press it down because sometimes you get a bit of trapped air at this end. Take your cap off, make sure you stick it in the dead centre of the bottle. And draw. And as you can see, there's a little air bubble trapped in there. So just squidge it back in. Try again. And I only want 4ml, which you can see just is there. Little trick, because it's been in fridge, I stick it under my arm, under my armpit. Make sure you put the cap back on it. Put it under your armpit for a few minutes while you're prepping the dinners. It'll warm the medication up, then it's not as big a shock when you actually inject it into the scruff of the neck, which I'll show you what to do next. So once it's warmed up, we'll go on to that bit. Right, a little show of where the scruff of the neck is on a dog. I know you know where the scruff of the neck is, but it's the bit where the mummies used to pick them up when they were a pup. It's this loose bit of skin, as you can see here. Now what I tend to do is come from the front of the dog while she's got her head in the bowl, pull the scruff up, which forms like a little V-shape pad area, and obviously go in between there so you don't go into your fingers. You'll see when I do it when she's having a dinner, which I'll show you in the next part. You'll find a distraction for the dog is the best time to actually give her an injection. Sometimes we were giving her it while she was actually having a dinner, and sometimes when she was sat on settee, but then she started reacting a bit weird and she started jumping when I were near her with syringe when she was sat on settee or something. So I just changed tacts and carried on giving her it with her meals, and she don't bat an eyelid. That's the best time we've found anyhow. Right, injection time. Scruff up, insert needle, like that.
happy.
So as you can see from my other video, the injection part was quite easy. She didn't flinch a bit. So stick with it. You can cope with a dog with diabetes. If we can, anybody can. Right, see you later.